guys, welcome back to Medical Coding with Blue. Today's episode is all about what medical coding employers are looking for in their candidates, and does the school that you attend matter for medical coding training? If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so when it comes to these employers, I've been getting a lot of questions from people that are saying, Blue, does it matter what school I go to for medical coding training? Does it matter to the employer? For 99.999% of them, no, it does not matter. There's going to be a very rare instance where it does matter to an employer, but then they've probably got some other thing going on. But when it comes to the vast majority of them, no. What these employers are looking for in medical coding candidates, obviously, is that you're certified or that you are about to be certified. That's what they're concerned with, because that says that you've already completed a program or you've already done all your independent study and that you've taken your exam or you're about to take your exam. The most important things that employers are really looking for in medical coding candidates, whether you have experience or not, is your ability to be able to read. Comprehension is very key. So with that, you have to know medical terminology and anatomy. Those are the two biggest skills that you have to have as a medical coder. If you do not understand the documentation, it's going to be very easy for you to select the wrong code. I have said many times some examples. Gastrocnemius muscle is one that comes to mind. A lot of people will say, oh yeah, well that's in the stomach. Wrong. That's actually in the lower leg, because that's something that you have to learn. And if you know your anatomy and you know your medical terminology, that's going to really, really come in handy there. So those are the two biggest skills that they're looking for when it comes to medical coding candidates. And obviously, having proficiency with the coding part. But that's just another facet of what they're looking for in a candidate. Some people have said, well, Blue, I'm not really good with computers. I don't really understand what not good with computers actually means. Now, if you are saying that you don't know how to do all this fancy stuff, like with, like edits and things like that, as far as like with videos and stuff, that's not what we do here anyway. When it comes to medical coding, they do give you training on the electronic health record that you are going to be using. So don't be fearful about that. Sometimes people are wondering, well, I don't know, like some of the big names like Epic or Cerner, I don't know those because I'm brand new. Well, they will give you training, because not everybody has the same package when it comes to the electronic health record that they use. Epic is really big on this, because every facility is going to have a different package. Some have more in-depth packages than others. So it really all depends. But they will give you training on that. So if that's what you're worried about, then, don't worry, because that's a part of the training that they will give you. Again, what they're looking for is to make sure that you at least are competent in the coding part. If you can get the coding part down, if you've got that part down, then the rest of it is just going to be learning on the job, as far as like the software that you'll be using. So don't worry about anything that's too far advanced in computers, okay? That's why I say don't worry about all that, because if it's just the electronic health record that you're scared of, again, they will train you when you get started with their system, because they have to train you on their system anyway, The other thing is the basic stuff like Word, Outlook, the email, Excel spreadsheets. These are just basic things that you have to know, because you are going to be using these. Outlook email is very easy to use, and Word documents are very easy to use. Excel spreadsheets, they're fairly simple and basic to start off with. And then of course, anything that's going to be advanced, like formulas, you're not going to have to probably be working with those. That's going to be like your supervisor that's going to be doing those kinds of things. And even if you did have to work on a spreadsheet that required something like that, there's tons of videos on YouTube that are showing lots of really good tutorials on Excel spreadsheets as well. So it's nothing to be really concerned with. I've seen people want to run away from medical coding because they think that, oh, it's a lot of computers, it's a lot of this, it's a lot of that. And that's just a small facet of what medical coders work with. I mean, sure, we work with the computer all the time, but it doesn't mean that we have to be so in depth with it. Okay, we are not software coders, we are medical coders, and that's two different, completely different professions. So just something that you have to know. The other thing that you have to know is basic math, okay? And especially if you're going to work with medical billing, right? If you're going to be doing any kind of medical billing, it's good to know percentages. It's good to know multiplication, division, subtraction, addition. But these are all things that you can do on a calculator. So again, not anything to be so worked up about when it comes to, oh my gosh, what other skills do I have to have? Okay, math is very basic. Do not get scared about the math. If you allow math to be frightening for you, again, you're going to be losing out because it's such a small thing. And medical coders have to know very small amounts of math. I mean, plus, minus, multiplication, division math. That's it, you know, very basic, very basic. But again, not anything to get too worked up about. The other thing is typing. You know, some people are asking me, well, I don't want to have to do a lot of typing. We don't really type a lot unless we're typing to make a query, right? We're writing out a query. And a lot of times people will, companies, not people, but companies will use query templates. And all you have to do is basically plug in, you know, your information into this template that's already written out. And then you send it on to the provider. So again, it's very, very easy things. It's not anything that's really heavy. If you say, well, I can type, you know, only 25 words per minute, it doesn't matter because most of the time we're working with the mouse, the clicky mouse, because we're entering stuff into the electronic health record as far as like, you know, using 3M, like the encoder and things, and then getting the codes and entering it in wherever it needs to go. And that's what we do. But it's just basically like henpecking. So if you're a henpecking typer, you know, meaning that you use your two fingers to type, it's totally okay. You know, it's not anything, again, to be too worried about, oh, I'm a slow typer. You'll get faster with time. Everything is with time. And when it comes to like these skills, as long as you have the basic stuff coming in, or at least a willingness to be able to learn what you need to learn and not get so overwhelmed, you know, that's a good thing. You know, when I see people talk about, oh, I get overwhelmed this and overwhelmed that, you know, guys, you need to kind of toughen up a little bit, you know, and that's the tough love medical coder in me with all of you, because for some people, everything scares them. And how are you supposed to ever reach anything wonderful and great in your life if you're always worried and constantly focused on the things that scare you, rather than, okay, I can figure this out. I can look at a video on YouTube. I can look it up somewhere on Google. I can look this up somewhere, or I can have somebody explain this to me, or I can just ask, you know, how do I do this? And that's a part of your initiative. It's your initiative to be able to do all of these things that is going to get you further in your career than somebody who is just allowing everything to frighten them. You know, it's not that scary, guys. I mean, when it comes to a career, and especially a career as in-depth as medical coding, because medical coding is quite in-depth once you get into it. But it is on you to accept the responsibility of, okay, I've got to learn this. I can learn this. I can watch videos on a particular subject. Like if I need to watch HIPAA videos to understand HIPAA better, if I need to watch a video on how to make a basic Excel spreadsheet, there's a ton of them on YouTube, all right? If it's that you have trouble writing, and writing is another skill that employers are looking for. If you're a good writer, and it's going to show like on your resume and your cover letter that you are a good writer or not. If you're not showing that, if you're showing like that you make grammatical errors, or you're misspelling things, or you're not capitalizing things where you should when you're writing things out, this is an issue, especially when there is so much software out there to help you. This is not an ad for Grammarly, but Grammarly is a wonderful tool that can help you to become a better writer, because you can start off by simply writing just a few things, and then you can run it through Grammarly, and Grammarly will tell you, like, it'll tailor your audience, you know, like, is this for an academic paper, or is this for business, or is this for personal? And then that's how it kind of helps you. And so once you start getting into those types of things, it's going to be easier and easier with time. But again, if you allow yourself to be overwhelmed by thinking of all the other things that employers are looking for, you may just quit altogether, because it's just not what you had hoped it would be, as easy as you had hoped it would be. I say this all the time. This is not easy. Medical coding is not for the faint at heart. It is not for the faint at heart. If you get, really, again, just overwhelmed by a lot of things, and you don't learn how to manage your time or manage your stress, that's going to really be harmful for you if you can't do that. And it's actually easier than you think to be able to manage one thing at a time. It's not that you don't have time. It's just that you need to learn to prioritize things. And if it's that, okay, Blue, I don't understand when I'm looking at a chart, when I'm looking at an op note, I don't understand where to go. Okay, that's where you can start first. That's where you can say, okay, I need to focus on more in-depth with diagnosis coding, more in-depth with procedure coding. And that's how you build from there. But those are the types of things that employers are looking for. Somebody who's willing to take those things that they don't understand and do their research. They're looking for people who know how to do their research. And research, knowing how to do research, is as easy as asking Google. It is as easy as asking Google. So there's no problem there. It's not like back in the day when we had to go through the Encyclopedia Britannica if we wanted to write a report on something, right? And so now it's just as easy as, going to Google and being able to do those things. So, that's just something that you have to be prepared for, all right? So don't get all worked up thinking that you need to be a fast typer, because no, you don't. Don't get all worked up because you're not really comfortable with computers. Although in this age, I don't know how anybody is not comfortable with computers. We all have smartphones. Everybody has a smartphone. And while some of us are not as tech savvy, I will admit that I am not tech savvy. I'm not tech savvy, but I'm comfortable with computers because I've worked with computers forever, but I'm not tech savvy in that you see that my videos are not edited. I just talk. It's just me and the camera, and I speak. And I don't have to have all of these fancy graphics, no matter what anybody tries to sell me. These people that tried to contact me from Fiverr that I can't stand is so annoying. But they're like, we can edit your videos. I don't care. My videos do just as well. And I'm about to hit 28,000 subscribers on my channel that are all organically grown. And I don't have to purchase subscribers. I don't have to purchase views. I don't have to purchase, graphics for my channel at all. So I'm just saying, if that's you, if you're in that same boat where you're not tech savvy, but you work with computers, that's the difference right there. Okay. So keep that in mind. You are better at these things than you think. Okay. So you are more skillful than you're giving yourself credit for. And not giving yourself credit for the things that you do know is going to be your downfall if you allow yourself to keep thinking that way. Because somebody could say, I'm not good with computers, but they can do all of those things, but they just can't do advanced things. And that's always understandable, because that's being more tech savvy. Whereas if you just have the basic knowledge, then you're going to be fine. I've had people tell me, well, Blue, I don't want to do typing all day long. Well, no, you're not doing typing all day long. You're reading all day long on a computer. Okay. And people are concerned with the blue light and things like that. There's glasses that you can get for that. There's always the filter that you can put on your computer. Most new computers have that option where you just go into the settings and then you can click on that blue light filter and then it'll filter the blue light. So that's always an option for you. It's just a matter of taking the time to learn these things, but it's the person that is tenacious. It is the person that will go after all the things that they want and be upfront about the things that they know, their knowledge base. Those are the people that are going to get the employer's attention, okay? And those are the things that employers are looking for. People who are very clear in their speech. And that's another thing too. If you mumble, or you say, oh, well, I don't really know, and I'm not sure, and I'm what do you want? You always answer the question, or you think in your head, what is it that you want? What are you looking for? I want a medical coding job. Okay, great. Why do you want this medical coding job? Because I went to school. What did you learn in school? ICD-10-CM, CPT, HCPCS, HIPAA, OIG, medical terminology, anatomy, patho, pharma, all these things. Very clear, concise, and to the point. That's what employers are looking for. Somebody like that. Not the person that says, I'm looking for a training position, a new person position because I need my hand held. No. If you're putting out that energy, or even if you have that on your resume, right, that you're seeking an entry-level position, you got to get that off of there, guys. You got to get that off of there because you have the skill. You have the skill because you have the training. And if you say, I don't feel confident, Blue, work with the workbooks. Work with the workbooks, and you will get more confident, okay? It takes time to build that confidence, but you have to show that you're more sure of yourself, and especially when you're out there and you're applying, that's what's going to get these employers' attention. Those are the extra things. Somebody who is well-spoken, well-written, and you don't have to love writing. You don't have to love it, but you have to be at least clear, and you have to have good grammar. And again, there's Grammarly. There's all these other programs that are, good with helping you with grammar that are going to go, a long way into helping you. Okay, so well-spoken grammar, medical terminology, anatomy. Those are the things that employers are looking for. Those basic things, right? And being able to clearly state what you want and being direct in that will be very helpful for you. It's a matter of not just building your knowledge base as a medical coder, but also your professional skill. That's in somebody that is willing to do that, and showing that and giving that energy of I'm willing to learn is going to go, again, a long way into getting these employers' attention, because everything else can be taught along the way, but you just have to show that willingness. That's where they'll get you, right? That's where they'll get you. That if you're not willing to show willingness to be able to look things up on your own, if you don't have that, that's going to go a long way into get you not hired. Okay, you want to show that if you don't know something, that and especially when they're interviewing you and they say, well, what about this and what about this, I need to do some research on that and I'll get right back to you. And then actually do your research and get back to them on whatever, so that's going to show the person that says something better than I don't know. I hate those words. I don't know. I can't stand that, because that's somebody that's not showing the effort to be put in. I don't know. If other people say it, that's on them. But you at least need to be the one to try to figure it out. At least that's my advice anyway. So with that said, it is a journey, guys. It is a journey. But ultimately what the employer is looking for is going to be in the job listing. So look at the job listing. And also know where you are applying. If you don't know anything about that facility other than the fact that they're hiring people, that's not good enough for you to say that's the reason why you want to work there. You have to let them know, why do you want to work there? Well, this hospital is known for cutting edge technology, and I'm really excited about learning how the coding aspect of that goes, and what I can do to help with my training that I've gotten in my own personal self-study that I've done. Guys, build it up. These are the things, again, that they're looking for. And somebody who actually puts in the effort. Because at the end of the day, that's what they're looking for. And these people, they don't know you and you don't know them. But you need to be showing, okay, why are you here? This is why I'm here. I want to be a medical coder. I want to be an outpatient coder, profi coder, or an inpatient coder. And you need to say why. All right? Those are the things that employers are looking for. Okay? Very basic. Nothing special about this message other than it's just done today. I've talked about all of these skills before, okay? But just these are things to keep in mind, guys. You can do it. And when you're out there, have fun with it too. You're gonna meet a lot of fun people in these interviews, and the vibe you get from an employer may not be what you want, and you may think, nah, this is not where I want to work. But you know what? It was good to get this practice. It was good to get the practice, because you have that attitude, and trust me, you will get a lot further along than the person who is defeated all the time. Okay, I'm just saying. So with that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.